Hey guys, this is Dr. Patel with Harmony Oral and Facial Surgery. I'm a board-certified oral and maxillofacial surgeon. Today we're going to talk about dental emergencies. What are some of the situations that can present themselves and you need to take them more seriously than you would otherwise? Okay, so one of the things is a pain. Okay, pain that came out of nowhere and now you're dealing with it for days. And now you have some swelling, you can't sleep at night, and it's starting to really, make your life uncomfortable. This is not something you want to wait on, because anytime you have pain and it progresses to swelling, it can also progress to a more severe infection that, probably needs to go to the operating room to be drained, and we don't want it to get there, okay? So if you can address the pain, the sooner, the better, okay? So any sort of pain associated with any of your teeth or your face or your neck, we need to address it sooner than later, all right? Anytime you have a tooth that's broken or has a large decay on it, that's not causing pain. Now, it's not causing pain. Why is that an emergency? Well, think about it this way. It's not causing pain yet until it starts causing pain, and then it can swell up overnight. That's how bad this is. So any infection in your tooth, it's not gonna just stop right there, okay? Especially if it's visible. It's bacteria in there and they're continuously working in there, and all they have to do is just break through the tooth structure enough to get down to the nerve, to get down all the way into the bone, and then they can easily break through the bone, because now your body's gonna react to this, because body's trying to fight this back. And your body will help the process by breaking down that bone and causing an abscess, okay? So we don't want anything that's not causing pain yet, but does look like it's visibly decayed or broken. We need to take care of it sooner than later. Another emergency could be if you're to fall down and a tooth is to get hit and gets pushed any whichever way, pushed out, up, inside, into the socket, pushed out, or it's just mobile, okay? That's something we want to address pretty much within that hour, okay? Sometimes we're able to push the tooth back in its socket where it's belong, and we can secure it there and keep it that way for 6 weeks. That can actually help you save your tooth and keep it in place. Although that's not always possible, sometimes the bone can break with it, and in which case we may have to consider removing the tooth and placing an implant or anything of that sort. So that's something you want to be mindful of. Another thing that I most often see is for kids, okay? If kids are to get swelling or fever, it's a telltale sign that you need to act on this sooner than later, okay? Kids can progress and go south pretty quickly, okay? So if kids are complaining of pain or swelling or have redness, you need to act on it immediately and get them to dentist, oral surgeon, or even to the hospital if you have to, okay? Getting on antibiotics sooner than later can be the only thing that can make the difference, okay? Or even the treatment even better, okay? Sometimes you'll see that getting infected teeth out while you're infected can be harder to get you numb, because the medications that are supposed to get you numb don't always work in that environment. When you have an infection, the environment becomes more acidic, okay? In an acidic environment, these medications don't work as efficiently as they're supposed to. So sometimes we may even have you take antibiotics for a couple of days, let the infection calm down a little bit, and proceed to the treatment. So just some of the things that you want to keep in mind. And there could always be more emergencies. If you fall, you can break your jaw. That's an emergency. You need to consider seeing, going to the emergency room and getting a CT scan to have a better evaluation, okay? So hopefully this clarifies on what things you need to act on right away versus what are the things you can, wait on and address later. All right, well, if you have any questions about any of your situations, feel free to give us a call at 839-400-2244. Until then, goodbye.